Most women calculate their fertile and safe days wrongly, and this leads to surprise pregnancy or months of trying without success. Today, I will show you how you can calculate your fertile and safe days accurately without any confusion. Don't miss this video. If you are seeing me for the first time, my name is Dr. Ugwuanyi, and this is the Family Health Academy. Today, I will teach you how you can calculate your fertile and safe days accurately using a simple method that every woman can understand. I'm also going to tell you a common mistake that most women make and how you can avoid this mistake. Whether you are trying to conceive or you are trying to avoid pregnancy, this video will guide you step by step. Watch this video till the end because the last part is going to surprise you. Let's go to the main topic. We said how to calculate your fertile and safe days exactly or accurately. For you to calculate your fertile and safe days, you must know your menstrual cycle length. Menstrual cycle lengths are number of days from the first day you started the bleeding till the day before your next bleeding. That is the day before you start seeing another period. Okay, let me use this calendar, this December calendar for instance. So this is December calendar. Let's say you started seeing the first day you start seeing your menses is on first. That is, let's say on December you start seeing December 1st, you start seeing your menses. Then you circle it first, and the next time you're going to see it will be something around the 29th. Okay, so it means your menstrual cycle length is 1, 2, 3 to 28. So it means it's 28 days. So your menstrual cycle length here is what? 28 days. But if you started seeing it, let's say on second, or let's still use on first, and the next time you are going to see it again is on 30th. It means your menstrual cycle length is 29 days. Okay, so and so what are the normal range of menstrual cycle length? Menstrual cycle length normal range is between 21 to 35 days. So it's not a must that everybody will have 28 days. You can have a 25, you can have 21, you can have 30, you can have 34. So it's not a must that everybody must. I just use this one as an instance. Okay. So now having known how to know your menstrual cycle length, or if you have already known how many days your menstrual cycle length. So how do you calculate your ovulation day? Ovulation simply means releasing of an egg. That is the day your ovary releases an egg called an ovulation. And it normally happens, that is after the release of an egg lasts for about 12 to 24 hours. The lifespan of the egg is 12 to 24 hours. Okay, so let's say your handling this ovulation, it has a formula. They say that ovulation day is calculated 14 days before your next period. 14 days before your next period, or you just say menstrual cycle length minus 14 days. Okay, this 14 days is just a study done, and they did a study and they came out with these 14 days. Okay, so I know that most of you will ask me how did this 14 days. It was a study done, and it's just like a constant, okay, constant number. So let's say, for instance, now that we assume that our menstrual cycle length is 28 days. So what is our possible ovulation day? Ovulation, just say 28 days minus 14, and you get you get you get 14. Okay. So this is now, but because ovulation happens on a single day, we instead of saying 14th day, you just say day 14. Okay, you just say day 14 because ovulation happens one day. One day in the sense that it only lasts for 24 hours, maximum of 24 hours. So that is our how to calculate ovulation day. So let's use another example. Let's assume that your menstrual cycle length is 30 days. We have used 28. Let's use 30 days now. Just say 30 days minus 14, and you're going to get 16 days. So because of it happened on a single day, you just say day 16. Okay. So this is how you can calculate your ovulation day. So how do you calculate your fertile days? Fertile days is the days in your menstrual cycle that your chance of getting pregnant is very high. So how do you calculate this fertile days? Fertile days is calculated having gotten your possible ovulation day. You just say 5 days, eh, 5 days before your ovulation. So 5 days before your ovulation plus the day of your ovulation. That is total of 6 days. Don't worry, I'm going to explain it so that you understand it better. So that is so how does this 5 days come about? 5 days in the sense that the sperm when released into the female reproductive tract, they can only last for a maximum of 5 days. While egg lasts for a maximum of one day after the release. So let's let's use this calendar for instance again. Okay, so let's assume that our ovulation day was on 14. Remember how I calculated the ovulation day? So let's say the ovulation day is on 14. So if you say 5 days plus one day, that is total of 6 days, as I said before. So if you say 5 days, this is ovulation day. Okay, so you just say 1, 2, 3, 4, 5. Okay, this is ovulation day, which is this one. This is the 5 days, which is this one. So your fertile window will be from 9 to 14 days. This is the time that you have a high chance of conceiving after after unprotected intercourse. That is if you are trying to conceive. Okay, so during this period now, it's advised for you to have sex every 2 days, or if you can have it every day or so that when the egg is going to be released, there will be a sperm that will fertilize the egg. Okay, so if let's say you have sex on 9 5 days, you still have chance the sperm will still be present till this egg is released. As I will say 1, 2, 3, 4, 5, which is the 5 days that the sperm can last. If you have sex here, the sperm will still be alive till then. If you have on 11, it still be alive. So if you have on 14, it still be alive. So, but if you are trying to avoid pregnancy, so this, if you are trying to use this method to prevent pregnancy, you need to add a more extra, either minus or plus 2. The reason why you are adding this minus or plus is that there is so many things that can affect your ovulation can change as a result of that it happened exactly. For instance, now stress or traveling or illness, this can alter your ovulation. So in order to be on the safer side, just add plus or minus 2. That is from let's say from this 7, you add another 2 here, that is making it up to 16. Okay. So this is how you can calculate your fertile days. So So let's now talk about the safe days. What are the safe days? Safe days are the days in your menstrual cycle that your risk of becoming pregnant is very low. That is why it is called safe. Understand? So how do you calculate your safe days? Safe days are the days outside your fertile period. Okay. So let's say our fertile period, according to what we calculated, is from 9 to 14. So other days, days before the fertile window and days after the fertile window is what we call the safe days. Okay. So these safe days, for those that are trying to avoid pregnancy, these safe days is used for people that have consistent regular cycle. That is those that have a menstrual regular that have a regular menstrual cycle. Because those that have irregular, the ovulation can be unpredictable. Understand? So the ovulation can vary. So because of to be in a safer side, it's advised that you use other method that can and use other method that can support uh, this um, this calendar method. So don't use only the calendar method. Like you know about your natural signs of ovulation that your body is ovulating. Okay, so I have already discussed about five most important ovulation sign that your body is ovulating. So if you want to know more about it, I'm going to drop a link on that so that you know because it's very important. That's your body, the natural way your body is can tell you that yes, you are actually ovulating. So when you combine those signs with this calendar method, your accuracy will be very high. Okay. So how can you confirm that actually one is ovulating? Yes. How do you confirm that one is really ovulating? For you to, your body has a natural way of telling you that yes, you're actually ovulating. And if you want to if you want to become pregnant, this is the right time. Like the egg white cervical mucus change, your sudden increase in libido, and your boost in energy, and the one-sided ovulation pain. So these are some ovulation signs that can guide you. If you want to know each of these ovulation signs, I have already discussed about them. I'm going to drop a link under the comment section so that you go there and watch it. Okay. So what are the common signs? What are the common mistakes that most women make, and how can you avoid these mistakes? Number one is that most people calculate their fertile days and save them without knowing their menstrual cycle length. You can see from what we did that we use the menstrual cycle length in all the calculations. Some people go ahead to even calculate without knowing that. So you have to know your menstrual cycle length. And some people just assume that the ovulation occur 14 days before your next period. No, like I said, you just as menstrual cycle length minus ovulation minus 14 days. Whatever you get is your possible ovulation day. Okay. So and some people also use this calendar method for calculating fertile days and safe days in those that have irregular menstrual cycle. Like I said before, this is not the you will get the faulty results because it's this during irregular menstrual cycle, your ovulation is not predictable. Okay, your ovulation is not predictable because of the changes in hormones and because for you to have a regular menstrual cycle, it means that there is a coordination between your brain, your ovaries, and your uterus. So anything that alters this pathway can affect your menstrual um, cycle and your ovulation. So if you found this video very useful, please, I want you to hit the notification button so that you won't miss any of our video. Hit the like button so that this video can be visible to other women. So, and comment, share so that many people can also see and benefit from this video. If you have not subscribed, please subscribe for more videos. We normally release the videos every week so that you won't miss any of our video. Having discussed about all this, I want you to drop under the comment section your menstrual cycle length using this method I just demonstrated here. Drop the calculation you got from using your menstrual cycle length, your fertile days, and your saved days. If you still want me to help you and calculate your fertile and saved days, I want you to drop your menstrual cycle length under the comment section. If you have any question on what I just explained, feel free to drop them under the comment section. I'm going to answer them personally.